So next speaker we have is Dr. Ehab Mohammed. He's a medical doctor, graduated from the Faculty of Medicine in Cairo, Egypt. He was trained as a medical and radiation oncologist in Egypt and practiced oncology for many years, and has worked as a professor in oncology in Cairo. At the present time, he's working as a licensed naturopathic doctor in Ontario. So we'll welcome him to the stage.
Now, if you just stand,
Is my voice? Close to the phone?
yep, if you just stand right here,
Sure. First of all, thank you for inviting me to this conference. It's my honor and pleasure to present. Let's see. Okay. Thank you. Good. This one here.
And we'll just put that on
You can put it in here.
Beautiful.
Thank you.
What are you doing?
Okay. I can adjust it. So, is it good? Everybody here? So thank you for inviting me to this conference. It is my pleasure and honor to present my history. Also, part of my story is a history, and then go to the practice after. So forgive me for spending like 5 to 7 minutes about a little bit of history, and before I'm going to explain what I'm doing to help cancer patients. So how to proceed for this one? It's okay. This is, everybody knows this. I think this is a season to go enjoy the nice breeze, right, and weather in summertime. So this building is in Cairo, where I was born and grown up there. This is Faculty of Medicine, where I studied oncology. And the history of this school is one of the oldest schools actually in the Middle East. It was originally a palace built by Ahmed bin al-Aini. It's from Turkish Empire, who invaded the whole Middle East area. But they built this as a palace for somebody in 1446. So it's more than 500 years, but still existing as a teaching hospital and facility. And it was changed to a hospital in 1827. So almost 400 years after it was changed to a hospital by leadership of Dr. Claude Bey, is France. So a doctor from France who came and started as a military hospital at this time. Now it has 36 clinical departments, 44 specialized units, and 5,500 beds, serving 2 million people from a great Cairo area. And there are 3,300 staff members and undergrads, almost 10,000 undergrads. So it is actually a quite big facility. This is a department where I started my postgraduate training in oncology. It's called Nemroc. So I spent 4 years. One is a general practitioners, and then 3 years mainly radiation, but I did rotate through medical and palliative oncology. Then I did 6 years of clinical practice and research, had my board certification 1998, one time, 20 years ago, more than 20 years. And to have the board in Egypt, it is a little bit different from the West, so I have to do some thesis research. So I did research on a glioblastoma multiforme, which was one of the most difficult brain tumors to manage because of its aggressiveness. And I did compare standard radiation, 54 grays, versus hyperfractionation, 72 grays in 7.5 weeks. And as in head and neck cancers, if the radiation oncologists are sitting here, the hyperfractionation only improves disease-free survival. It's not improving the overall, but it did increase the period or time where patients live without active disease, but the overall survival was not different. I did 36 research articles, all peer reviews on oncology in different areas, like breast cancer, colorectal, non-Hodgkin lymphoma, mainly in radiation, but some in chemotherapy and palliative care, and was promoted to professor of Cairo University in 2009. Then I spent almost 12 years in Saudi Arabia. I worked in oncology department in Jeddah, Saudi Arabia. But because they follow the Western system, I was mainly allocated to radiation oncology because I have most of my research in radiation. And I like this because it's light surface. To be honest, chemotherapy, palliative care, heavy duties. Patients suffer a lot, have a lot of suffering. Radiation is like the peace of mind, right? But I did all, so I'm happy with this. Then this is my journey. After 20 years of doing oncology in the Middle East and Egypt, I decided to come to Canada as immigrant in 2013, so almost 6 years now. And to be honest with you, when I started to continue my career as an oncologist, it's a little bit hard because I have to do residency training again after 20 years. And even though residency training spots are very little, 2015 they have 2 residency spots for international trained doctors all over Canada. So it was very, very difficult. Then I started to think and outside the box. How can I do? Because my family came here, I cannot go back. I made my mind to come to a different country. So I thought about naturopathic medicine, and actually my wife suggested it to me. So she's the one who changed my route. But I thought totally about this, because in the whole Middle East, we don't have any naturopathic medicine. We don't know about it. And here in the West, we're talking about Canada and the States, it is here for 100 years. See, I read the history about this, 1900s. Initially, it came from Germany and British, and it came to States first and then shifted to Canada. But still, many people don't know what is naturopathic medicine. Maybe some of you know, but it is not actually, everybody knows about it. So this is the first question I answered about why I choose a study to naturopathy, because I found this an exit for me to practice medicine in a different context, in different way. But most important, why I continued, because some people, my classmates who joined the same program, this is actually a 4-year postgraduate program in the naturopathic school in Toronto. This year, 2013, they started a new bridging program for internationally graduate doctors to have only 2 years instead of 4 years. And it's very tough because you have to have all the information of naturopathic medicine, the same information in 2 years instead of 4 years. Some of my colleagues, they gave up and they went back to their home countries, but I didn't think so. I thought I have to do something different. Because I joined the oncology clinic of this school for 1 year. So I saw the cancer patients in this school are different from the cancer patient I saw 20 years back in my home country. I saw patients with metastatic disease. They are active, they are eating well, they have a good memory, they are focused, they are performing well, differently than patients I saw in a complete different shape. Performance status is different. They have the same lines of treatment, but the additional thing, they have more different interventions, which will go through this soon. So this is a simple picture of the naturopathic medicine. It's actually healing power of nature. We know in medicine, we give chemotherapy, we give radiation, we give medicines, which is great. We have no problem with this. It is great. But about the body energy, the nutrition, the sleep, things we get it for granted. We think, for example, if we sleep 5 hours, 4 hours, it doesn't matter. No, it matters. And there is a research actually done in the States about nurses who have night shifts. They spend the night awake for 8 hours, 12 hours, versus nurses who have only day shifts. They found the incidence of breast cancer is higher for night shift nurses, which doesn't come from space, because these nurses have, when they did analysis, they found the nurses who have night shifts have low melatonin. Melatonin responds for sleep. But also it's found that it's good as an antioxidant, which means it fights cancer. So if you don't have enough melatonin, which means also enough sleep at the right time, possibility of having cancer is existing. So this makes me more interested to go through this path to explore things that not everyone knows, especially the medical communities, and this will add to the patients. This will add to their treatments and management. So we'll talk about modalities of naturopathic medicine. What things we can use that helps cancer patients? First of all, let's start with intravenous treatment. There's a lot of things about nutrition, vitamins, and supplements, tons of information. But I'll give you the snapshots of the things that really can improve patients' performance. One of the things is the intravenous treatments that can help cancer patients. And one of the things, actually, we'll start with, before we start the interventions, we'll talk about very common problems that patients suffer, cancer patients suffers. One of the most important problems that is difficult to manage is chemotherapy side effects, especially fatigue, nausea and vomiting, GI problems, anemia, leukopenia. We know all of these, they are given medical treatment. So cancer patients who've been through chemotherapy, they give a standard, dexamethasone, metoclopramide, and granacetrone as an antiemetics, right? As a combination. Before it was given as needed, But now, not now, maybe for 15, 20 years ago, they will be given for every patient because they think that chemotherapy will induce nausea and vomiting for almost more than 90% of patients. So they are giving these medications to reduce the symptoms. However, some of the symptoms like fatigue, for example, we don't have a solution for that. And I heard from one of the presenters that fatigue was one of his complaints. It is a big issue. Having GI problems, anemia is all of stuff we know about chemotherapy. These complications doesn't only affect the patient's performance or feeling about the treatment, but from my experience as previous oncologist, they do affect their decision to start treatment. So many patients actually shy away from chemotherapy simply because of side effects, which from the scientific point, it can impact their survival. Many patients like early breast cancer patients, for example, some of lung cancer early cases, they can be improved with the chemotherapy. But then because of the side effects, they sometimes give up, which is not the right thing. And this is the reasons of fatigue. We'll talk about fatigue a little bit more in details. When the oncologists start to look for the reasons, they found a myriad of reasons, like anemia can be a reason, poor nutrition, medications like chemotherapy, and anxiety itself can cause causing this fatigue. So we'll focus about the chemotherapy-induced electrolyte imbalance. Why I mention this? Because this is related to the intervention I wanted to talk about. There was a lot of research about fatigue, and as we mentioned that anemia can be caused, some infections, for example, can be the reason. This can be solved, like you give apatine or blood transfusion for anemia, iron. But the most important is actually electrolyte imbalance. And this research was published in the Cancer Chemotherapy Pharmacology Journal in 2017. They found that platinum-based chemotherapy, which are mainly used for ovarian cancer, lung cancer, and some cases of breast cancer. Actually, platinum is used quite often, although with development of new targeted agents, tyrosine kinase inhibitors, a lot of investigation agents, but still platinum is used in at least 30% of cancer patients, if not more. They found that there is a lot of electrolyte imbalance for these patients, regardless of this baseline. So we suppose these patients come with completely normal levels of electrolytes, magnesium, calcium, potassium. Almost 100% of them will go to low magnesium, low potassium, phosphorus, sodium, and calcium. And this will impact their performance. They induce a lot of fatigue and poor physical and mental performance. To correct this electrolyte imbalance is not an easy task. I'll tell you, if somebody went through this article, magnesium in particular is not directly evaluated by simply measuring the magnesium in blood, because magnesium in blood represents only 50% of magnesium in the body. And the other 50% are bound to plasma proteins and tissues. So if your body is deficient of magnesium, the blood magnesium stayed normal, but the internal body organs, the bound form to the plasma proteins is very low. So even if the person go to the ER, supposedly for any reason, they check magnesium, can come as normal, but their proteins and the internal organs are very deficient. And this is tricky because the ER physician cannot give magnesium for a patient with a normal magnesium, right? How it comes? There is no justifications. And if the patient comes with fatigue, what to give them? If they are a little bit dehydrated, give sodium chloride or lactate ringer. But this article actually stresses on supplementing cancer patients with magnesium, because they know inherently that cisplatin, in particular chemotherapy, deplete the body with from magnesium. It's going to be depleted to the degree that patients will suffer a lot of fatigue, weakness, sleepiness. That's why when I started my practice in naturopathic medicine, I talked to peers and colleagues in the States, actually. They have this, what's called intravenous recovery program. It's actually based on high dose of magnesium. So it's containing magnesium, calcium chloride, and vitamin C, B12, and in a normal saline or water. And this is an indication, so cancer-related chemotherapy, fatigue, nausea, and vomiting, lower immunity, We can give it prophylactically before the symptoms appear. It's not interfering with chemotherapy. It is not interacting with chemotherapy. It's all electrolytes. And in my practice, I give it the 1 day after chemotherapy because this is where the hit of chemotherapy happens. It lasts for 2.5 to 3 hours because cancer recovery program. So far, I treated 15 patients for this who had a chemotherapy-related fatigue. 14 showed great improvement of it. They have no fatigue whatsoever. Only 1 patient had no difference. This is the thing I am interested to present to you today as an intervention. There are other interventions, but because of the time factor, I will pass quickly. So we have high dose vitamin C for advanced cancers. Sometimes patients consumed all available options from oncology. They had chemotherapy, radiation, targeted treatments, but still have active disease. So these actions, I have a study also about this I will mention shortly. Acupuncture, omega and L-glutamine for chemotherapy-induced neuropathy. So this is also a high problem with patients with Taxols and cisplatinum. The induced peripheral neuropathy patient cannot feel. Hyperthermia and solid tumors, head and neck cancer, bladder cancer. They have some information to improve response to radiation therapy, and hyperbaric oxygen for what's called radiation toxicities. Scientific evidence. We have a lot of debate about how naturopathic medicine works in general. And the things I got from other practitioners, that there is no lot of evidence. We know this fact. There are some of them have some evidence, like high dose vitamin C, hyperbaric oxygen. But for this IV program, I know there is no big evidence, but I use for my patients. I know it's helpful and is not harmful. So what is the point using something which is not harmful, not interfering with conventional treatment, but improving the patient quality of life? Research needs huge patient numbers. It needs budget. We don't have budget for that. So some of them are little bit evidence-based, some of them are more evidence-based, but we can go with the things that are, I think it is safe for the patients, at the same time not harmful to them. This is the research I did, a single case study on hepatocellular carcinoma published in Radiology and Cancer Research last year. A gentleman, 71 years old, diagnosed as hepatocellular carcinoma. He is not alcoholic, he had a fatty liver, and he had pain in the right hypochondrium in 2017. Ultrasound revealed hepatic nodules, and these nodules proved to be hepatocellular carcinoma with biopsy, and the tumor marker alpha-fetoprotein was at this time 500. So they decided to give him chemotherapy, intrahepatic, what's called intrahepatic chemoembolization. He get it, but the tumor marker rose after that. Then you had radiation inside the liver tumors. The tumor markers rose after that. He came to me, I told him, listen, there is no strong evidence for your case, but he has no other choices. The doctor told him, you have few months to live, 6 months, and then you will go. They told him, okay, we'll start for you high dose vitamin C and mistletoe or helixor. There is one case study published in 2015 about hepatocellular carcinoma that goes completely off with high dose vitamin C. I give it to him. I told him, listen, there is no strong evidence, but this is the only thing I have for you. I give him every week the high dose vitamin C and helixor. After 5 months, we followed his the tumor marker was rising. The PSA reached down to 13,000. But his liver enzymes were down, improved. His performance was good, which is counterintuitive. I told him, listen, we have no control of cancer because that tumor marker is jumping, but you are doing fine. Your liver functions is fine, which is not logic. If you like to continue the treatment for quality of life, I'll continue for you. It's money, it's interventions, every week to the doctor's visit, but this is for quality of life, not for you. He accepted, he took it, and after 3 months, so now we have like 8 months for treatment, alpha-fetoprotein down to 3. It's almost controlled, it's almost cured. So I'm believing much for these interventions, also it is not evidence-based. I have a few slides to finish. So we'll talk about the integration. Now we know naturopathic medicine exists. We have the license to practice in Ontario, and we are helping patients. I am very happy that any of the doctors treating patients, oncologists, medical doctors, have these patients gain advantage of this. We have the facilities, we have the tools to help them. I have patients who are really performing very well and satisfied with the service. So I hope that we have some sort of integration with the oncology community, given the fact that we are working under licensures. It is not something from our own, and also people getting advantage of this. Is it existing? Yes. where, so in the States, they have many clinics. This is called integrative cancer clinics. They have the oncologist, surgical oncologist, radiation, medical oncologist, and naturopath. If you Google the CTCA, Cancer Treatment Center of America, they have 5 hospitals in Atlanta, Chicago, Philadelphia, Phoenix, and Tulsa. And the team, as I told you, radiation, medical oncologist, and nutritionists, and also naturopathic doctors. There is also other centers in Germany and Australia. And this is the end of my story, my presentation.
So any questions?
Okay, thank you.
Excellent.
Thank you very much.